The University of Nevada's sports medicine team specializes in injury and illness and prevention, assessment, treatment, rehabilitation, and education to every student athlete. The program is committed to being a sports medicine program of excellence. Nevada athletic trainers and medical staff play a major role in maintaining the health and physical well-being of all Nevada student athletes. The facility houses the Wolfpack athletic training staff, which consists of 5 full-time certified athletic trainers, 3 graduate assistant athletic trainers, and a number of student athletic trainers. The sports medicine department provides medical care and treatment to more than 430 PAC athletes representing 19 sports. The athletic trainers have access to technology available within an aquatic therapy room, including 2 in-ground pools and an exercise pool. The facility also has a separate functional rehabilitation area, ice wet room, and storage facility. Training staff is led by the Director of Sports Medicine, Shelley German, followed by Assistant Sports Medicine Directors Ben Anguish, Jay Henke, Brian Everett, and Cody Zimmerman. Throughout the duration of our internship, we had the pleasure of having Graduate Assistant Chad Schmidt as our site supervisor. Not only does he work with Nevada football, but he also overlooks Nevada swim and dive. As an intern with the University of Nevada Sports Medicine, it was my responsibility to create a rehabilitation guide as well as put together a PEP program which focused on ACL injuries for the university's athletes. The PEP program stands for Prevent Injury and Enhance Performance Program. The rehabilitation guide will serve as an outline to be used by licensed athletic trainers in the athlete to better understand timeframes and outcomes associated with the athlete's ACL reconstruction rehabilitation process. Female athletes who participate in jumping and pivoting sports are 2 to 10 times more likely to sustain a knee ligament injury, such as an ACL injury, than male athletes participating in the same sports. Currently, the university athletics is experiencing a decline in the amount of ACL injuries among their athletes. In total, there are less than 5 student athletes with current ACL injuries. Because of the incorporation of a PEP program among the female soccer team, there has been a recorded incident of 1 ACL injury in 3 years. This is imperative because female soccer players tend to have higher occurrences of non-contact ACL injuries. Football is currently experiencing 2 players with contact ACL injuries. The PEP program consists of a warm-up, stretching, strengthening, plyometrics, and sport-specific agilities to address potential deficits in the strength and coordination of the stabilizing muscles around the knee joint. The program should take approximately 15 to 20 minutes to complete and should be completed 3 times a week. However, when you first begin the program, it may take slightly longer due to the fact that you must first become well acquainted with the program and the transitions. The warm-up portion of the PEP program is to prepare athletes for activity. The strengthening portion of the PEP program increases knee strength, which will create a more stable knee joint. Plyometrics will help athletes with power, strength, and speed, while also having the athlete focus on their landing. Agility exercises contain 4 runs with 3-step deceleration, lateral diagonal runs, and bounding runs. 4 runs with 3-step deceleration help the athlete to properly accelerate and decelerate while running. The final stage in the PEP program is stretching. Stretching is important because it helps the athlete maintain range of motion, reduce stiffness of joints and muscles, reduce post-exercise soreness, reduce injury, and improve overall performance. My sports medicine internship consisted of becoming more familiar with the modalities offered in the facility. It was my goal to understand the role of modalities here at the university and to see what could be done to improve their effectiveness. With high goals set, I wanted to work towards gaining at least 1 new modality for the benefit of not only the faculty, but the student athletes as well. Modalities offered at the university include Russian STEM, ultrasound, omnistem, cryotherapy, thermotherapy, and different types of hydrotherapy. Many of the student athletes use these very modalities to help with prevention and rehabilitation of injuries. At least 25% of Nevada football uses modalities to help assist with the healing of injuries occurring during the on and off season. Athletes will utilize their prescribed modality anywhere from 10 to 20 minutes per session. Sessions can take place multiple times a day or even 3 to 4 times a week. Depending on the aggressiveness of treatment and severity of injury, session times may vary. After learning more about modality effectiveness, I came to find out that the modalities cannot necessarily be compared to one another, nor can their effectiveness be easily measured. The effectiveness of each modality can fluctuate depending on how each athlete's body responds to treatment. In some scenarios, an athlete will have a very positive response to modality treatment, while another athlete's body will show little to no improvement after the same treatment. The only way to attempt to improve the effectiveness of a modality is by pairing different modality treatments together. With gaining a new modality as the last thing on my to-do list, I thought it'd be helpful to ask the sports medicine staff what they'd like to see.
There's another modality that we could have here in the athletic training room would be a Hivamat machine that helps promote lymphatic return, which helps decrease swelling and acute injuries faster than any other modality out there.
If we could have one other modality here at the University of Nevada, I would love to have a Normatec MVP system because of the way it helps with recovery for our athletes and all the other things, especially with surgery. And
anti-gravity machines like the Ultra G and the underwater treadmill are great alternatives when trying to progress an athlete back to sport-specific conditions. It allows the physical therapist and the athletic trainer to monitor the amount of weight bearing that's being done and to allow them to easily progress athlete back to full return to play.
In addition to our training room, modality-wise would be a paraffin bath. As simple as it is, uses hot wax to heat up an injury site, get it loose, something like a finger, you jam a finger. It's just easy and very convenient, so I think it'd be a great addition to our training room.
Unfortunately, I was not able to get a new modality for the facility. However, I was able to put together a helpful modalities reference guide for future staff and future interns.
Yes. And that, ladies and gentlemen, is how you make health happen.